Thank you so much for welcoming me today. Again, my name is Marcy Stagner. I came up from Memphis yesterday, and I'm the Director of Strategic Partnerships and Opportunities with Church Health in Memphis. And for those of you who might not be familiar with the work of Church Health is a nonprofit organization in Memphis that works to create equitable access to health care for people who are working but cannot afford health insurance. So within Church Health, we have, I think, 72 about-ish provider rooms. We have behavioral health, we have dental, we have vision, we have a kitchen, a nutrition hub to teach healthy eating habits. We have something called The Well, which is sort of a child care entity. So patients can get their children taken care of while they're getting their medical needs met. We also provide very low-cost health plans that work similarly to health insurance. It's not health insurance, but it is for people who cannot afford the health insurance that their company is offering. So all that to say, the CDC did a study in Memphis, their Places study of Shelby County, and this study rated Shelby County, which is Memphis, in the surrounding areas, Shelby County higher in hypertension, diabetes, and obesity than the general U.S. population. And this tells us that Shelby County isn't healthy. The CDC also tells us that hypertension is more common in non-Hispanic Black adults than in non-Hispanic white adults. And with the population in Memphis being what it is, majority Black city, the rates of hypertension, obesity, and diabetes has skyrocketed, and it's uncontrolled, and it isn't getting better. So with this partnership with Meharry Medical College, of course, you guys are familiar with that in Nashville, the University of Memphis, United Methodist Church, Methodist Le Bonheur Hospital, and Church Health, we are working together to build a pipeline so that students from North and South Memphis, which, if you're not familiar with the area, those are some of the poorest zip codes in the country, not just the poorest zip codes in Memphis, not just the poorest zip codes in Tennessee, but the poorest zip codes in the entire country. And of course, the health disparities in those areas are related to the poverty in those areas. And so we're looking at what would it take to put a pipeline together so that students from these areas, from the poorest zip codes in the country, in Memphis, could have a pathway to not only attend medical school, but to graduate from medical school, pass the MCAT, become physicians with a commitment to practice in Memphis. Because the research also shows that trust within the healthcare system is built with doctors from the same racial background as their patients. So this partnership will transform the health outcomes of Memphis. It will transform the possibilities within these partnerships, and I know specifically there are lots of ways the United Methodist Church is going to be able to plug in, but specifically with Project Transformation, for example. We are using the pipeline protocol and the pipeline system, the pipeline, overarching programs of the Student National Medical Association to build this pipeline so that it is hyper-local to our city, so that it is relevant and addresses the needs of our city and its residents. So if you'd like to learn more, I'm happy to talk with you about it. That's what we're working on, and thank you so much for welcoming me today.